Hello and welcome to Talking General Practice, the podcast from GP Online. I'm Emma Bower, the editor of GP Online. Today on the podcast, I'm joined by our deputy editor, Nick Bostock.
Hello.
And our senior reporter, Kimberley Hackett.
Hi everyone.
To talk about the latest news affecting general practice. Coming up, we're talking about the GP employment crisis and concerns about what job opportunities await the many GP registrars due to qualify this summer. We'll be looking at the latest on the general election, discussing the BMA manifesto and what the political parties have been saying about general practice. And we're talking about GMC regulation of physicians' associates after the regulator set up some further details about how this will work. Our good news story this week is about a new surgery development in North Yorkshire. That's all to come on this episode of Talking General Practice. First up, we're talking about the GP employment crisis. We've spoken about this a few times on the podcast, including the last news episode where we talked about concerns that GP registrars due to qualify this summer could face some real challenges finding work. The BMA has warned that there are up to 80 applicants for every GP job that becomes available at the minute. Nick, this is a problem that we've seen developing since probably around the autumn last year. Before we come on to the latest story you've done this, can you perhaps do a bit of a brief recap on why this is an issue and why it's become a problem now?
Fundamentally, this is about the consequences of underfunding of general practice. A campaign launched by the BMA in the last few days says every practice in England is struggling to keep its doors open. So that's the scale of the crisis that the profession's facing. We've talked before about the BMA saying that general practice is receiving about 50% less funding in real terms now than it was 15 years ago. But just over the course of the 5-year contract that ran from 2019 to the end of March this year, the financial pressure on practices has intensified. Lancashire and Cumbria LMCs said earlier this year that to keep up with inflation, practices would have needed a 28% increase in funding over the course of that 5-year contract, but they actually received just an 11% total rise over that time. So the average practice is about £350,000 short of the annual funding it would have had if funding increases had matched inflation, according to the LMC's calculations. So funding just hasn't kept up with rising costs. And the inevitable knock-on effect of that underfunding is that practices simply can't afford to recruit. We've been writing since last year about practices being unable to afford the GPs they need. This year, the BMA has said thousands of qualified GPs are struggling to find work. And we've reported on cases of out-of-work GPs using food banks and a GP working as a taxi driver for Uber. This is also against the backdrop of ring-fence funding for the Additional Roles Reimbursement Scheme, the ARRS. This is funding that can be used to recruit staff such as physios, pharmacists and physician associates, but crucially is not available for hiring GPs or practice nurses. So at the same time as funding for practices to hire GPs has dried up and GPs are struggling to find work, these other staff are coming into the general practice workforce in large numbers. We actually had a case at the start of the year of a practice making some of its GPs redundant because it was moving to a model with a heavier reliance on additional roles staff. And it said it was doing that, I think, in response to guidance from NHS England, effectively. Ultimately, underfunding has led us to what the BMA has called a disturbing paradox. Practices are busier than ever, but unable to bring in available GPs that they would love to recruit.
So, Kimberley, you wrote a really shocking story last week that really shows the extent of this recruitment crisis, in particular how the issue is affecting GP registrars. So these are doctors currently in specialty training to become GPs. Can you tell us a little bit more about your story?
Yeah, so lots of people may have seen this story. I wrote about a shocking case of a GP registrar who is due to qualify in the next month and has applied to work in Tesco because there aren't any GP jobs available. I found this out from Dr. Mark Jorbon, NHS England's East Lancashire Training Programme Director. He told me he knew of this GP registrar from a neighbouring training programme. Now, it's come to this after the registrar contacted every practice within a 45-minute drive of where they live, and there aren't any vacancies. So it's not a case that they are applying, being interviewed and then rejected. That's not it at all. It's simply that there aren't any jobs being advertised. And some people might say, well, why don't they just move? But the GP registrar can't because they have a family and need to stay local. We've spoken on previous episodes about the very real concern from the BMA, for example, that GP registrars might not be able to find work once they qualify. And applying to work in Tesco really is one of the most shocking examples that we've come across to date. And Dr. Jourbon told me that in his cohort of 30 registrars, only one of them has a job lined up. They have had to travel nearly 20 miles to find this job. And his other 29 registrars are also really worried and said their biggest stress is not finding work, while it used to be exams.
Yeah, it's a really terrible situation. I mean, we spoke on the last news podcast, didn't we, about GPs speaking at the UK Local Medical Committee conference, really worried about this. I heard a few people saying that there are literally no GP jobs available in their area at all, much like you were describing there, Kimberley. Obviously, this isn't what anyone would have expected when they started training to be a GP, given we know that there's actually a national shortage of GPs. Dr. Jourbon said this is the first time he's seen anything like this happen, didn't he? I mean, Nick was talking earlier about the fact that this is something that's happened relatively recently. What does Dr. Jourbon think is going to happen with this cohort of registrars?
Yes, so it really is unusual, and Dr. Jourbon told me that this is the worst GP job market he has ever seen, and in previous years, final year registrars would be confident of finding work or have a job lined up by now. He said he's never known of a situation where trainees close to qualifying can't even find vacancies. He fears that we could lose many of our newly qualified GPs overseas, and he told me that this could be a big problem with international medical graduate GPs. Now, if you are an international medical graduate, once you have qualified as a GP, you only have 4 months to find a visa sponsor practice. In Dr. Jourbon's cohort, roughly 60% are international medical graduates. Now, if they can't find a practice that is A, a visa sponsor, and B, has vacancies, it means that more than half of his cohort could be forced to leave this country. Earlier this year, we carried out a Freedom of Information request that revealed only a quarter of practices in England are visa sponsors. And we know that more than half of GP registrars in England are international medical graduates. So if the GP job market isn't fixed soon, we could lose so many UK-trained GPs to other countries like Canada and New Zealand that are actively recruiting UK-trained GPs. Dr. Jourbon also told me that the vacancies that GP registrars are seeing advertised are for physician associates, and he said there is a real sense of resentment, not to the individuals, but to the physician associate role itself. Now, for Dr. Jourbon, the lack of vacancies available for newly qualified GPs has made him feel quite upset. He said he and his colleagues are finding it distressing and as though they are letting young doctors down.
We're going to come on to talk about the general election in a minute in a bit more detail, but the GP recruitment crisis was forced front and centre over the weekend after a GP confronted Prime Minister Rishi Sunak about the issue while he was out campaigning in Wiltshire. A GP who we think is Dr. Jane Lees-Millay challenged the Prime Minister at a rally on the 7th of June, and there's video footage of that which you can actually see on our website. She told the Prime Minister that she was currently unemployed because of the Conservatives' policies on general practice, and accused the government of the constructive dismissal of general practice, which is a term we've actually heard before from BMA GP Committee Chair Dr. Katie Bramall-Stainer. One of the issues she raised is about the fact that, as Nick mentioned earlier, practices are now relying on less qualified staff. So she's basically talking about the ARRS there, which means primary care networks have the funding to employ people like pharmacists, physicians associates, physiotherapists, but not GPs. Kimberley, you mentioned physicians associates earlier, and I think there's particular anger among GP registrars that PA jobs seem to be available in general practice when GP jobs aren't. So in response to that encounter on the campaign trail, Rishi Sunak said he respectfully disagreed with that GP and that he thought it was right that people can see pharmacists to make it easier to get the care they need. Obviously, he was referring to the Pharmacy First scheme, I think, really in that response, and not the ARRS. He said that as the son of a GP and a pharmacist, which we've heard quite a lot during his time as Prime Minister, he would always support primary care. But clearly this GP and many others don't believe that that is what the government is doing. The BMA put out a statement about Sunak's encounter with the GP, and Dr. Bramall-Stainer called the GP unemployment crisis a national disgrace, and again said that constructive dismissal is exactly what general practice was witnessing. I mean, you mentioned that in recent months we've written stories about a qualified GP taking up work as an Uber driver and locum GPs turning to food banks because they can't get enough work. I mean, I mentioned earlier that this is all coming at a time when we've seen a huge expansion in GP training in recent years. So we've got record numbers of GP registrars at the minute, haven't we?
Yeah, GP training's expanded a lot in recent years. There are about 50% more doctors entering GP training each year now than there were a decade ago. In 2014, just under 2,700 doctors started GP training, and that figure has been rising each year to the point where since 2021, there have been just over 4,000 doctors starting GP training each year in England. But that just isn't translating into an increase in the number of fully qualified GPs working in England at the moment. The BMA GP committee chair for England said on Twitter the other day that more than 25,000 GPs have been trained in the past 10 years, but that the fully qualified full-time equivalent GP workforce has shrunk by around 2,000. So why are these large numbers of doctors coming through GP training not translating into an increased GP workforce? Part of it is what we've been discussing earlier. Practices can't afford to recruit, so as we've been hearing, registrars, doctors who are training to become GPs are having to look outside NHS general practice to find work. Dr. Malinga Ratwat, the BMA GP Registrar Committee Chair, said earlier this year that thousands of registrars who are due to qualify this summer as GPs are coming into a job market that's non-existent, and that's particularly the case in some parts of the country. We also know from BMA polling that less than 2/5 of current GP registrars plan to work in NHS general practice. So lots of these doctors who've qualified in the UK to become GPs at great expense to the state, in fact, will move overseas to work, or as we've seen, look for other types of work, sometimes medical, sometimes non-medical. In the meantime, the BMA says around 10,000 GPs have retired or left the profession in the past 10 years. So one of the criticisms of the government's NHS workforce plan was that it was weak on retention. It was big on training new GPs and other doctors. But what we're seeing here is that this isn't just about retention of experienced GPs at the end of their careers or persuading people not to take early retirement. It's also about keeping GPs right at the start of their careers. And that means ultimately improving working conditions and pay so that the NHS can compete as an employer with health systems in other parts of the world, and funding practices properly so that they can offer jobs to the doctors who are coming through GP training as we speak.
That was obviously one of the things that was so disappointing when we saw earlier this year the decision to scrap those fellowship programmes, because they were very much about retention and trying to keep doctors in the NHS early on in their careers. It was all about giving new GPs support and ensuring that they were able to develop fulfilling careers in local areas.
It actually had a function at the other end of the scale, because the point of the mentor scheme that goes hand in glove with the fellowship scheme was that it provided a more interesting role for more experienced GPs, something that would help retain them in the workforce as well as supporting newer GPs who are just entering general practice.
Yeah, absolutely. We know the BMA has been calling for the ARS to be changed so that PCNs and practices can use that money to employ GPs and practice nurses, which they can't at the moment. That seems like the most sensible thing that could happen to solve this problem we're facing with, newly qualified GPs not being able to find jobs. And I'm sure this is something that BMA and others will be pushing the next government to look at again.
Yeah, I mean, at a time when funding's so tight for practices that they can't afford to recruit available GPs, it does seem baffling that the ring fence around this pot of ARS money, which is worth £1.4 billion a year, hasn't been relaxed to allow practices freedom to use it for GPs and practice nurses. And in the absence of a big uplift to core funding for practices under a new government, changing those rules around the ARS will definitely be a priority for the BMA beyond the 4th of July, as you said.
Moving on, we're now well into the general election campaign. So what have the political parties had to say about general practice, and what do doctors want to see from prospective MPs? Nick, shall we start with what the doctors want? The BMA published its manifesto for the election last week. What is the BMA calling for?
Yeah, just to be clear, this isn't a manifesto just about general practice. We're actually expecting a separate manifesto from the BMA GP committee imminently, potentially this week. as well. So we'll be writing about that on GP Online soon. This manifesto is from the BMA as a whole, and its title is Patients Need Doctors. And that speaks to the sense that the current government simply doesn't value doctors in the way that it should. And that's reflected in the fact that consultants, junior doctors and GPs now have been or are in dispute with the government over contracts, funding and pay. And the BMA chair, Professor Phil Banfield, says solving any of the big challenges facing the NHS, tackling waiting lists, improving productivity, improving patient safety, those all depend on positive engagement with doctors ultimately. He made the point that unless the government, or now the next government, starts to value and protect the medical profession, all the problems facing the NHS currently will only get worse. So there are 5 key points the manifesto asks political parties to adopt. Those are basically value doctors and restore their pay, prevent erosion of doctors' professional role, to train and crucially provide jobs for the next generation of doctors, deliver the funding the NHS needs and safeguard the health of the public and prioritise preventative healthcare. In terms of GP-specific points, there's a demand for new contracts for general practice in England, Wales and Northern Ireland to safeguard GP partnerships. And the BMA GP Committee Chair for England said only last month that a new substantive contract for general practice should include measures like a recommended cap on patients per GP and a target share of overall NHS funding. There are currently 2,300 patients for every fully qualified GP in England, which is far above the safe limit suggested in BMA guidance, which is something like 1,800. And on funding, we know general practice currently receives something like 7 or 8% of the NHS budget. And the BMA and RCGP have traditionally said that share should rise to more like 11%. So that's the kind of share of funding GPs might want. And it could be more if there's an expectation that more care moves out of hospital in future. And any cap on patients per GP is likely to be closer to the 1,800 patients per GP sort of level, although that too could change to reflect the fact that patients are on average becoming more complex and consulting more often. The manifesto also calls on an incoming government to stop the substitution of doctors with medical associate professionals. So that means physician associates and anaesthesia associates. And it calls for an end to red tape that stops existing general practice funding being used to recruit GPs and practice nurses. And that sounds obviously like a direct reference to the ARRS again.
So this week we've also seen the political parties' manifestos published, so it's probably worth having a roundup of what they had to say about general practice. Nick, first off, what did the Conservatives have to say?
So the Conservative manifesto came out on Tuesday this week, and one of its big promises on healthcare is to modernise primary care services. Much of what was in the manifesto repeated things we've reported on previously. So the Conservatives have said in the past few weeks that they would build 100 new GP surgeries and modernise 150 more. They've said they want to further expand the Pharmacy First scheme and that they'd carry on building more community diagnostic centres. There's no mention in the manifesto this time of a specific number of GPs the Conservatives would deliver over the next Parliament, presumably because they've had their fingers burnt on promises like that in the past. So the last Conservative manifesto, of course, promised 6,000 more doctors in general practice, and since then we've seen the fully qualified GP workforce drop by more than 500. And that promise came after a previous promise of 5,000 extra GPs, which also didn't materialise. What the manifesto does say on the workforce is that the Conservatives are committed to the NHS long-term workforce plan, and that it expects that plan to deliver 92,000 more nurses and 28,000 more doctors than the number there were in 2023 by the end of the next Parliament. One thing to point out on that is that the National Audit Office said earlier this year that the workforce plan would grow hospital consultant numbers 12 times faster than GPs, and that the workforce plan was essentially built on the substitution of fully qualified GPs with other healthcare staff and registrars. So those 28,000 doctors the Conservative manifesto mentions, I mean, perhaps we shouldn't expect all that many of them to be GPs. There are some other bold promises in there, like returning performance levels to the targets in the NHS constitution by the end of the next Parliament. So that's things like A&E targets and ambulance targets and so on. They're also saying they would invest more in premises, and there's also a plan to release funding for other services by cutting the NHS management workforce by around 5,000. The BMA response to the plans is pretty clear. It said that the manifesto was full of ideas we've already heard, and it was difficult, essentially, to take any of it seriously given the Conservatives' record over the past 14 years in government.
Actually, at the time we're recording this, we're yet to see the Labour manifesto. So we're recording this on Wednesday and the Labour manifesto is due out on Thursday. So by the time you listen to this, it will have appeared. So you'll be able to read about that on our website. But aside from the manifesto, Labour has spoken a lot about its plans for the NHS over the past year or so. So it's perhaps worth us talking about some of those. So Labour has 6 key pledges. It calls it steps for change, one of which is to cut NHS waiting time. So that's obviously going to be a big focus for its health policy. Labour's big idea is to increase the number of operations, appointments and diagnostic tests that happen in the evenings and at weekends to bring down the waiting list. The party's also said it wants to get NHS hospitals working differently by setting up shared waiting lists and better collaboration between hospitals. In terms of primary care and general practice, Labour's also sort of set out a vision where there's more collaboration happening in primary care as well. They want to trial neighbourhood health centres, which we've actually talked about on the podcast before when they first announced these. And those are health centres that would bring together GPs, district nurses, care workers and possibly minor injury units that would be open 7 days a week. It's broadly based on an idea that's been introduced in Australia over the past couple of years, although it is quite different from that Australian model. But this is all part of a plan to move care closer to communities and shift the focus of the NHS towards primary care, which is also what Labour says it wants to do. At the Labour Party conference last year, Shadow Health and Social Care Secretary Wes Streeting said the party would place primary care at the heart of its plans to reform the NHS. But Labour's other big line is it wants to bring back the family doctor, in quotes there, and it says it will do this by reducing bureaucracy in general practice to free up GP time, making better use of the NHS app to make it easier to get an appointment. Wes Streeting's also spoken in the past about streamlining GP targets, including the QOF, to redirect money towards probably incentivising continuity of care. I mean, something that's perhaps also worth mentioning here is that Streeting's also spoken a number of times about pay restoration for doctors, although he said that is something that wouldn't happen overnight under a Labour government. He has said it would be a journey rather than an event. But given the current government won't even acknowledge the issue of pay restoration, for junior doctors in particular, that is quite a big difference between Labour and the Tories. Labour's also put forward ideas of people being able to self-refer themselves to specialists in certain circumstances. That idea was something a lot of GPs really disliked when it was first discussed earlier this year. And the party's also spoken about a focus on prevention, making better use of technology, which everybody seems to want to do, and expanding the mental health workforce. Obviously, all of those things could have an impact on general practice. In terms of workforce promises Labour has already made, they've promised 7,500 more medical school places and 10,000 more nursing and midwifery places, with a good proportion of the new medical school places allocated to under-doctored areas. And Labour says all of these changes will be funded by scrapping so-called non-dom tax loopholes and cracking down on tax avoidance to raise extra revenues. But it's really not clear exactly what Labour is talking about in terms of any funding increases for the NHS and how much money the NHS would get. I mean, maybe we'll see a bit more of that when the actual manifesto comes out. So as I say, we've not yet seen the manifesto while we're recording this, but you will be able to read about that on our website by the time you're listening. So the Liberal Democrats also have published their manifesto this week, and they had quite a lot to say about general practice, didn't they, Nick? It seems to be quite a big focus of their plans for the NHS.
Yes, the Lib Dems do have a lot to say about general practice, and I think it's fair to say some of it's likely to be welcomed by GPs, other bits maybe not so much. It's notable, actually, that the Lib Dems, in the launch of their manifesto, mentioned bringing back the family doctor, which is something you said Labour is also talking about. And it's notable particularly because that reflects a talking point that's been a big part of the Rebuild General Practice campaign. So that messaging from perhaps the BMA and the Rebuild General Practice campaign does seem to be getting through and making its way actually into parties' manifestos and thinking about the NHS in the run-up to the election. But the overall promise in the Lib Dem manifesto around general practice is a $1 billion package to improve general practice services. So they're promising 8,000 more GPs, half of which they say would come from recruitment and half from better retention. One promise in the manifesto is to scrap top-down bureaucracy to let practices hire the staff they need. That sounds a lot like a plan to relax rules around ARRS funding, which, as we've said, the BMA and many GPs would welcome. Although the party's press office hasn't quite confirmed that that's what it means, so it's not totally clear. Like the Conservatives, the Lib Dems say they would build on the Pharmacy First scheme, and the manifesto talks about giving more prescribing rights to pharmacists and others to try and free up GP time. They talk too about having access to a named GP for all patients aged over 70 and for everyone with long-term conditions. So that could apply to tens of millions of people. It could be a big challenge for general practice depending on how it's implemented. The Lib Dems are also promising to give all patients the right to see a GP or the most appropriate practice staff member within 7 days or within 24 hours if they urgently need to. And again, at a time when general practice is struggling with huge demand, a GP workforce smaller than it was in the past, that sounds like potentially a tough ask. Having said that, we know that in April, about 70% of appointments were delivered within a week of booking. Nearly half of them actually were delivered on the day of booking. About 80% were delivered within 2 weeks. And despite the criticism that general practice often gets for a significant proportion of appointments taking place more than a month after booking, many of the rest may well be appointments booked well in advance, because the statistics that we have from NHS Digital don't differentiate between appointments booked in advance and appointments where there's a genuine long wait. So it may be that the case that many appointments are actually already being delivered broadly within the timescales that the Lib Dems are talking about. There's also a line about a universal 24/7 GP booking system, but without any detail about what this actually means. It begs the question, would practices with really high rates of satisfaction currently with booking appointments have to change to this universal system, for example, potentially undermining whatever system they currently have that works really well and that patients are happy with? And there's also a promise for a 10-year plan to invest in improving the NHS estate, including in general practice, which could be really good news for GPs. The BMA said on this one that there were signs that the Lib Dems understand some of the huge challenges the NHS faces currently. So the response is a bit more positive than the one that the Conservatives got.
The other one that we've seen this week as well is the Green Party's manifesto. And that manifesto says that Green MPs in the next Parliament will be pushing for an increased share of NHS funding going into primary care and an immediate boost to NHS staff pay, which includes pay restoration for junior doctors. So that's the first one that's actually specifically mentioned anything about doctors' pay. The Greens want an additional £1.5 billion a year going into primary care. The party also has access to GPs on there. They say they want guaranteed rapid access to a GP and same-day access in the case of those with the most urgent needs, although it doesn't really specify what it means by rapid access. So the Green Manifesto says that the NHS is facing its biggest crisis in its 80-year history, which it says is a direct result of underfunding by the current Conservative government. The Greens are basically saying the NHS needs an additional £8 billion in funding during the first year of the next Parliament, which should rise to an additional £28 billion a year by 2030. Also wants £20 billion a year spent on social care to provide free personal care and increase pay for staff, and also £20 billion capital investment to improve hospital and primary care buildings, as well as replacing outdated equipment. Anyway, you can find all of GP Online's coverage on the general election on a dedicated page on our website, GPonline.com/election 2024. I just want to highlight one other piece that we've done, which is looking at the GPs who are standing to be MPs in the next election, which is really worth having a look at. We think we've managed to track them all down, but if there's anyone we've missed on that list, please let us know. Next up, we're talking about physicians' associates after the GMC provided an update on how regulation for PAs and anaesthesia associates will work. Nick, what did the update have to say?
So this was an update from the GMC to the government, to NHS organisations and organisations like the BMA and so on about how it's finalising its approach to regulating associate roles, so roles like PAs and AAs, physician associates and anaesthesia associates. The BMA and other doctors' groups have obviously strongly opposed plans for the GMC to take on regulation of these roles. And the argument they've made is that the GMC taking on regulation of non-doctors risks blurring the boundaries between doctors and other health professionals in a way that could put patients at risk and cause confusion. But legislation has now gone through Parliament and it'll take effect from December. From that point, the GMC will be formally responsible for the regulation of PAs and AAs. This update said the GMC would regulate doctors, PAs and AAs as distinct professions. So the GMC is saying there'll be clear lines between these different groups it'll be responsible for regulating. We've already heard some stuff about how the kind of numbers it'll use for doctors and for these associate roles will be different, with a prefix that sort of demarcates a physician associate as being different from a doctor, for example. But this update also tries to reassure doctors that they'll not be held accountable for the decisions and actions that PAs and AAs they're supervising or working alongside have taken, and that's as long as any tasks that they delegate to those staff have been delegated in line with various bits of GMC guidance. The GMC has also used the update to try and reassure doctors about the significance of a case in 2017 that's been talked about on social media quite a bit. And it says that case has been misrepresented as setting a precedent around how doctors can be held responsible for PA's actions. And it said basically this case involves significant concerns about the doctor over a period of time, and that although the doctor was found to have failed to adequately supervise a PA's review of a patient, there were other serious allegations involved that led to sanctions in that particular case.
Yeah, I mean, we've actually got an article on GP Online. We'll put a link to that in the notes for this episode about supervising PAs, which was written by the MDU. It's actually really useful, has lots of practical advice for GPs about which bits of that GMC guidance they need to kind of be in line with when it comes to supervising PAs. The MDU has actually updated that article this week to take account of some of this new information we've heard from the GMC. We also had another interesting story over the past week or so about physician associates regulation that's probably worth mentioning. So this is about a group representing anaesthetists called Anaesthetists United, who are crowdfunding at the minute in a bid to launch a legal challenge about the GMC's plans for regulating PAs and AAs. That group was initially aiming to raise £15,000, but it's now raised over £60,000 and it is aiming to hit £100,000. So the group said that they wrote to the GMC at the end of March, setting out their concerns about regulation of PAs and AAs. What they want to see is clear guidance from the GMC that defines the scope of practice of a PA and an AA, or they say the GMC should instruct Royal Colleges or faculties to produce those scopes of practice. The group also want a separate version of good medical practice for associates. I mean, under the current plans, good medical practice, that's the guidance which basically underpins the standards that the medical profession should operate under. But at the minute, the plan is for that guidance to apply to both doctors and associates, which this group's not very happy about. And they also want GMC to stop using this term medical professionals, which it has been using actually to group doctors and associates together when they're referring them, because the anaesthetists say this is very ambiguous and confusing. So apparently the GMC has responded to some of these concerns but failed to address others, and this is why Anaesthetists United have said the only route left is a legal one. The money they are raising is basically so that they can consult lawyers about what options could be available and how they can then put those legal arguments to the GMC in a way that would potentially make the regulator reconsider some of its plans. Before we finish, we've just got time for our regular good news story. This week's story is about a practice in North Yorkshire that's opened a new state-of-the-art building that will enable it to serve a growing local patient population in the town. The Sherburn Group practice opened the new £2.6 million building earlier this month, which has been funded with an £850,000 loan, £1 million from the NHS and £750,000 from the local council, and also help from the Community Infrastructure Levy. The new building has 19 consultation rooms, urgent care and phlebotomy services and ultrasound scanning facilities. And the extra space the practice has created will enable it to provide more appointments for patients and enable the practice to train more medical students. A second phase of the project involves the reopening of an old hospital building that will accommodate services provided by the council, including sexual health as well as district nurses. We were talking about premises on a recent episode of the podcast and actually talking about how difficult it is for practices to get funding for new buildings. So we thought it would be good to highlight this development as it is a really positive news story. Well, that's it for this week. Thanks to Nick and Kimberley, and thanks so much for listening. I'll be back next week when I'm talking to Dr. Carter Singh from the Rebuild General Practice campaign about some of the challenges facing general practice at the minute and what GPs want from the next government. So please join me then. In the meantime, don't forget you can keep up to date with all the latest news, including our coverage of the general election, on our website at GPonline.com.